been a medical officer for about 2 years now, and I work in the surgical ICU where we look after some of the sickest people in the hospital, patients that need constant monitoring 24/7. Sometimes I work 13-hour shifts, and most days, if I am lucky, I have time to heat up my lunch. It is super stressful. Every first or second year MO has their own collection of hilarious, dark, and tragic anecdotes. My own story isn't something that I would particularly say is tragic, but it is one that has stuck in my memory because it has changed how I am as a doctor. I get home after a long shift and I am welcomed by a letter. It looks important and I open it straight away. It is a registered letter from the HPCSA informing me that the family of a deceased patient have made a formal complaint to the hospital implying evidence of poor communication. What really angered me at the time is that the hospital themselves reported the matter to the HPCSA. If found culpable, I was at risk of losing my ability to practice. The letter said that I should contact my medical indemnity provider and that I had 2 months to respond to the allegations. I immediately called medical protection and I was very quickly put through to a medical advisor who created a plan of action and ran me through what to typically expect from the HPCSA formal complaints process. I provided medical protection with all of the patient notes that I had written down, and medical protection were able to formulate a timeline of events, and it aided in creating a draft response to the allegation, so like a letter of explanation. They acted pretty quickly and we were able to get a response out in a few weeks or so. All I could do was wait. That was the hardest part because I just couldn't switch off the negative thoughts. It had a huge impact on my mental health and my ability to focus at work. It completely knocked my confidence. The goals that I had of working overseas seemed somewhat over. 6 years of training for nothing. Medical protection put me in touch with their counseling service, which really helped me cope with the immense anxiety I was feeling. And I also attended workshops around patient safety and patient communication. The thought was that I could show the HPCSA, should it become a more formal inquiry, that I was taking steps to actively change the way in which I was working. When the letter from the HPCSA finally arrived, after 2 months of waiting, I had to sit down to open it. I feared the worst, but to my delight, the letter said that the HPCSA had accepted my letter of explanation. When I read those words, I just started to cry. All of the pressure was just released in that moment. The investigation was still ongoing and some of my colleagues had to attend further inquiries. I was just so thankful that my part had come to an end, but I felt really bad for my workmates. I remember thinking, I am so glad that I joined medical protection because I really do believe that that's what made the difference.